Assalamualaikum warahmatullahi wabarakatuh. I am Princess Suraida S. Matiwalu, and we are going to discuss the ethical issues on abortion in the Philippines. Despite advances in reproductive health law, many Filipino women experience unintended pregnancies, and because abortion is highly stigmatized in the country, many who seek abortion undergo unsafe procedures. Many women in the Philippines are unable to achieve their desired family size and have more children than they want. Unintended pregnancy is common, in part because of the high unmet need for contraception. The Philippine government has made efforts to improve access to contraceptive services, but abortion is illegal under all circumstances and is thus highly stigmatized. Nonetheless, abortion is common, but is often performed in unsanitary conditions and using outdated techniques. Unsafe abortion carries significant risks for Filipino women. About 1,000 die each year from abortion complications, which contributes to the nation's high maternal mortality ratio. Tens of thousands of women are hospitalized each year for complications from unsafe abortion. Poor women, rural women, and young women are particularly likely to experience unintended pregnancy and to seek abortion under unsafe conditions. Because of the risk of unsafe abortion, many women need post-abortion care, but they face barriers on obtaining such care, including the stigma around abortion and the high cost of medical care. Policymakers and government agencies should educate the public about contraception, ensure adequate funding for contraceptive services, and eliminate barriers to obtaining methods, particularly among disadvantaged populations, to help destigmatize post-abortion care. The government should train more providers in the use of safer and less invasive methods of care. In the year of 2013, July, the Philippines, with a steadily increasing population that is approaching 100 million, faces significant challenges in the area of reproductive health. About 25 million of its citizens are women of reproductive age, and they experience high levels of unintended pregnancy, have relatively low levels of contraceptive use, and frequently experience unsafe abortion and consequently high levels of mortality and morbidity. Services is opposed by influential groups. Women's access to reproductive health services faces challenges or outright opposition from various or often powerful segments of Filipino society. While contraception is legal in the Philippines, until mounting pressure to reduce maternal mortality and morbidity and to combat poverty in the Philippines or in our country arose in recent years, the government had shown only weak support for access to modern contraceptives. Since 1971, much of the free contraceptive supply had been funded by the U.S. Agency for International Development or USAID and other international donors, but in 2008, USAID is discontinued its support to encourage the Philippine government to become self-reliant. Local bans on contraceptives, such as the Mayor of Manila's executive order in 2000 to remove contraceptives from public clinics, and the 2001 ban by the Department of Health on the emergency contraceptive Postinor, created yet more barriers to access, and particularly affected poor women who rely on public services. In the Philippines, the Catholic Church hierarchy wields strong influence on society and on government officials. The Church not only condemns abortion but forbids the use of modern contraceptives. Despite this opposition, recent legislative developments have been supportive of reproductive health. In contrast to former President Gloria Macapagal Arroyo, who opposed public provision of modern contraceptives in favor of promoting natural methods approved by the Vatican. In contrast to the liberalizing trend in contraceptive policy in the Philippines, abortion law is among the strictest in the world. Abortion remains illegal in the Philippines under all circumstances, and is highly stigmatized. While a liberal interpretation of the law could exempt abortion provision from criminal liability when done to save the woman's life, there are no such explicit provisions. There are also no explicit exceptions to allow abortion in cases of rape, incest, or fetal impairment. The Penal Code considers abortion to be a criminal offense punishable by up to 6 years in prison for doctors and midwives who perform abortions and by 2 to 6 years in prison for women who undergo the procedure, regardless of the reason. A separate set of laws under the Midwifery Act, Medical Act, and Pharmaceutical Act permit the revocation or suspension of the licenses of any practitioner who performs abortions or provides abortifacients.
Hi, my name is Manalisa Panda, and today I'm gonna discuss to you with reference to abortion often leads to unsafe procedures. In the Philippines, abortion is very common and hundreds of thousands of Filipino women who have unintended pregnancies each year. Many face a difficult choice, either give birth to a child they are not prepared or able to care for, or obtain clandestine and often unsafe abortion. Because abortion is highly stigmatized and punishable by law, it is extremely challenging to directly estimate the number of abortions in the Philippines, as both women and providers are likely to not report the procedure. The most recent study on national abortion incidents in the Philippines used indirect estimation techniques and hospital records to estimate a rate of 27 abortions per 1,000 women of reproductive age in 2000, with lower and upper estimates of 22 and 31 abortions per 1,000 women. Notably, this rate was considerably higher than a more recent estimate of the unsafe abortion rate in Southeastern Asia as a whole, indicating that the Philippines may have more unsafe abortions than some neighboring countries. Who has abortions in the Philippines and why? According to a national 2004 survey of women of reproductive age, individuals who have abortions are similar to Filipino women overall. They're typically Catholic, are married, are mothers, and have at least high school education. The most common reason women identified for having an abortion, cited by nearly 3 in 4, was the inability to afford the cost of raising a child or an additional child. More than half of those who had an abortion said they underwent the procedure because they felt they already had enough children or that their pregnancy came too soon after their last birth. Nearly one-third of women felt that their pregnancy would endanger their health, and another third believed that their partner or another family did not want or support the pregnancy. The clandestine nature of getting an abortion often leads to unsafe procedures. The process of obtaining an abortion in the Philippines is often not straightforward and may involve many methods and attempts, some of which may have serious health consequences. While the skill and training of providers and the safety and effectiveness of methods vary widely, nearly all abortions are clandestine and therefore carry associated risks. Some women seeking pregnancy termination may be able to obtain medically recommended procedures such as manually vacuum aspiration or MVA or dilation and curettage, but the providers may be untrained or the settings unsanitary. In many cases, women are able to self-induce by taking misoprostol, also known by its brand name Cytotec, obtained through street or internet vendors. However, the drug is expensive and the correct dosage may not be dispensed, which lowers the effectiveness of the method. The health consequences of unsafe abortion are significant. The Department of Health acknowledges that high maternal mortality is preventable through the provision of effective family planning methods to combat unmet need, particularly among poor women, and that access to antenatal care and to care for pregnancy and abortion-related complications would also help to reduce maternal mortality.